30 million Americans have sleep apnea, and 80 to 90% of them have absolutely no idea. Every single night while they sleep, their breathing stops. Not once, not twice, sometimes hundreds of times, each stop lasting 10, 20, even 60 seconds. And every time their breathing stops, their oxygen levels crash, their heart pounds trying to compensate, and their brain fires an emergency alarm to restart breathing. This happens over and over all night long while they sleep completely unaware. And the damage it is doing to their heart, their brain, and their body is catastrophic. Today I am going to show you exactly what sleep apnea is, the 7 warning signs that most people have completely normalized, including the one sign that appears every single morning, and the simple test that can diagnose it from the comfort of your own home tonight. Sign number 4 is something that millions of people experience every single morning and have accepted as simply how they are, when it is actually their body sending a desperate distress signal. Sleep apnea makes you twice as likely to have a heart attack. It makes you 71% more likely to develop cardiovascular disease. And people with severe sleep apnea are 2 to 3 times more likely to have a stroke. Sleep apnea increases heart failure risk by 140%, stroke risk by 60%, and coronary heart disease risk by 30%. This is not a minor sleep inconvenience. This is a disease that is silently accelerating your risk of the most deadly conditions in medicine every single night while you think you are simply snoring. Here is what is actually happening inside your body. When you fall asleep, the muscles of your throat relax. In sleep apnea, they relax too much, collapsing and blocking your airway completely. Breathing stops. Oxygen levels in your blood begin to fall. Within seconds, your brain detects the oxygen drop and fires an emergency response, causing a micro-awakening, just enough to tighten the throat muscles and restart breathing, often with a loud gasp or snort. You never fully wake up. You have no memory of it. But this cycle repeats, sometimes 30, 40, even 60 times every single hour, keeping your body in a state of continuous physiological stress throughout the entire night. Here are the 7 warning signs you have sleep apnea right now. Warning sign number 1: loud, disruptive snoring. Symptoms of sleep apnea include stopping and starting breathing, making snorting noises, waking up a lot, and loud snoring. Not every snorer has sleep apnea, but almost every sleep apnea patient snores. The snoring of sleep apnea is distinctive. It is loud enough to disturb a partner in another room, and it is frequently interrupted by complete silence as breathing stops, followed by a sudden loud snort or gasp as breathing restarts. If your partner has ever told you that you stop breathing during sleep, this is a medical emergency that requires immediate evaluation. Warning sign number 2: waking up gasping, choking, or with a racing heart. The micro-awakenings of sleep apnea occasionally become full awakenings, particularly during severe episodes when oxygen levels drop dangerously low. The person wakes suddenly, gasping for air, sometimes with a sensation of choking or smothering, heart pounding. These episodes are terrifying when they occur, yet most people do not mention them to their doctor, because they pass quickly and feel embarrassing to discuss. Each one of these episodes is your oxygen level having dropped to a dangerous threshold, your brain forced to fully wake your body to survive. Warning sign number 3: needing to urinate frequently during the night. This is one of the most surprising signs of sleep apnea, and one of the most commonly missed. When oxygen levels drop repeatedly during sleep, the heart releases a hormone called atrial natriuretic peptide in response to the cardiovascular strain. This hormone signals the kidneys to produce more urine. The result: frequent nighttime urination that sends patients to urologists for enlarged prostate or bladder evaluations, when the real cause is sleep apnea creating a hormonal cascade they never suspected. Warning sign number 4: waking up every morning with a headache. Daytime symptoms of sleep apnea include daytime sleepiness and headache. When you stop breathing repeatedly during the night, carbon dioxide builds up in your blood and blood vessels dilate in response, creating a characteristic morning headache that is present the moment you open your eyes and fades within an hour or two of being awake. Millions of people take headache medication every single morning, have done so for years, and have never connected their morning headache to what is happening in their airway while they sleep. If you wake up with a headache more mornings than not, your sleep needs to be evaluated. Warning sign number 5: extreme daytime sleepiness despite a full night in bed. You sleep 7, 8, 9 hours. You wake up feeling completely unrefreshed. By mid-morning you are fighting to stay awake. By early afternoon you could fall asleep sitting up. This profound daytime sleepiness, called excessive daytime somnolence, occurs because sleep apnea prevents you from reaching the deep, restorative stages of sleep where your body actually recovers. You spend hours in bed, but almost no time in genuine restorative sleep. The result is a person who is technically sleeping enough hours but is chronically, dangerously sleep-deprived at the cellular level. Warning sign number 6: difficulty concentrating, memory problems, and brain fog. Memory loss and difficulty concentrating are reported by 70% of sleep apnea patients. The repeated oxygen drops of sleep apnea damage the hippocampus, the brain's memory center, over time. Patients describe difficulty remembering names, losing their train of thought mid-sentence, struggling to focus on tasks they used to handle easily, and a general mental cloudiness that they have attributed to stress, aging, or burnout, when the real cause is their brain being deprived of oxygen hundreds of times every single night. Warning sign number 7, high blood pressure that does not respond well to medication. Up to 74% of people with atrial fibrillation could have sleep apnea, and the repeated cardiovascular stress of oxygen drops throughout the night chronically activates the body's fight-or-flight response, flooding the bloodstream with stress hormones that keep blood pressure elevated around the clock. Many patients with treatment-resistant high blood pressure that does not respond adequately to multiple medications, have undiagnosed sleep apnea as the driving force. Treating the sleep apnea frequently improves blood pressure control dramatically. Now, the test that diagnoses it tonight. You no longer need to spend a night in a sleep lab. A home sleep apnea test available through your doctor and even some pharmacies involves wearing a small monitoring device to bed that measures your breathing patterns, oxygen levels, and heart rate throughout the night. Results come back within days. If the test confirms sleep apnea, treatment with a CPAP machine, a device that delivers gentle pressurized air to keep your airway open during sleep, is highly effective. CPAP therapy is effective in 95% of patients when used correctly. Patients who begin CPAP treatment frequently describe it as transformative, waking up genuinely rested for the first time in years, with improved memory, mood, energy, and blood pressure within weeks. If this video helped you recognize something you or someone you love has been living with, please share it right now, because millions of people are sleeping next to someone whose breathing stops every night and accepting it as normal snoring when it is a medical condition destroying their heart one night at a time. Subscribe and hit the bell, because in my next video I am going to reveal the disease that is silently poisoning your blood right now, building up for decades with zero symptoms, and the shocking truth about the one number on your blood test that your doctor has been watching go up every year without ever explaining what it is actually doing to your body.